Good afternoon, everybody. Thanks for sticking around. I think this is going to be a great, interesting session. Today, the title of my talk is Acknowledging the Expert in the Room, Engaging Families in Direct Care. So the objectives, I would like to discuss the state of patient family-centered care in the ICU setting very briefly, and then introduce something called the Family Involvement Menu to engage families in direct care, and discuss implementation methods for adapting the Family Involvement Menu to any setting. Disclosure. So this work is supported in part by the Gordon and Betty Moore Foundation through a research grant. And we would also like to acknowledge the Society for Critical Care Medicine. Last year, our team was awarded the Family Centered Care Innovation Award for this work. So thank you very much for your dedication to family-centered care. So I like to start by asking, many of you, have you been in the ICU as a patient or as the family member of a loved one? And what was it like for you? What were you doing most of the time? Were you maybe reading a newspaper, watching television, on your laptop, catching up on work? So what if at that time a nurse came up to you and then said, "Oh, would you like to help in the care of your loved ones?" And I think as a healthcare professional, that would resonate especially with us. I asked this question because my colleague, Rhonda Wyskiel, a critical care nurse at Johns Hopkins Hospital, who is the lead in developing this work, 11 years ago, she was in the ICU, and her mother was the patient, and she was the family member. And at that time, all she wanted to do was to comb her mother's hair, because that was sort of like a tradition for them. And the nurse came by and said, "Oh, no, don't do that. You would agitate the patient." And Rhonda was a nurse, so that was kind of strange. And then the nurse went on and said, "Oh, you shouldn't ask any questions." And in the end, what happened was her mother passed away from a medical event. So this stay in the ICU really impacted Rhonda and her perspectives as a healthcare professional, and her take on family-centered care in the ICU. In the literature, we know that there is a lot written about family-centered care, and I think, especially in the ICU setting, the family is an important person because they can help operationalize the whole idea of patient-centered care in the ICU. And I think what we see right now is some sort of shift where it's no longer we, the healthcare professionals, allow the family member to become a part of the team. It's what should be expected. And the idea behind that is a lot of the family members, they have been caregivers to their family members for many, many years because their loved ones may have been critically ill. And they know the most what the needs and wants of the patients are and can provide valuable insight. From the perspective of the healthcare professional, we all know that effective teamwork is important to improving healthcare outcomes. However, current research has focused very much on teamwork between healthcare professionals. That is, teamwork between social workers and the medical staff and the nurses, maybe the EVS, but everybody overlooks family as part of the healthcare team. And so there's an opportunity here to include family members as part of the healthcare team. So I'd like to ask you to again reflect on where your unit is in this patient and family-centered care journey, and give you an example. In the Weinberg Intensive Care Unit, this is the surgical oncology intensive care unit, 20 beds at Johns Hopkins Hospital in Baltimore, Maryland, where the family involvement menu was developed. The WICU was opened in September 2000, and in 2003, we implemented open visiting hours, and this was quite a revelation for everybody, going from seeing the family members on the unit for 15 minutes per day, perhaps, and then seeing family members basically sleeping on the unit. And to the leadership, they were sort of concerned, what is happening? But then soon they saw the value of this, and I think the value would be that the family members are now present on the unit, and this presence opens up a whole door of opportunity to engage them. So in 2003, we invited family members to join daily rounds. 2004, invited family members to be in the room during emergency situations if they would like. 2008, we started the Family Meeting Project for ICU patients who've been on the unit for 7 days or more. They could meet with the physician, the nurses, the social worker to understand the care goals and just get a status update on their loved ones. And then in 2009, we implemented the Continuity of Care for Patients, which is family education for continuity of care. And finally, in 2010, we implemented the Family Involvement Menu. So I've talked a lot about this family involvement menu. What is the family involvement menu? The graphic here is slightly small, but on the top part, it basically acknowledges that the family member is a critical part of the care team and that they are very knowledgeable. And then at the bottom, not dissimilar to, for example, a food menu, there's some choices. So you could choose which activities you would like to participate in as a family member. And so I think what's to emphasize here is there are choices you could choose based on your comfort level, what you would like to participate in. You don't have to, but this provides a good opportunity. So how was this tool developed? We conducted some interviews of nurses in the WICU, the Weinberg Intensive Care Unit, to ask them if they were visiting a loved one in the intensive care unit, what they would like to participate in. And then from their professional perspective, what they felt was appropriate, because certain things, someone without a clinical background may have more trouble with. And then we did interviews of 12 families to understand their interest in participating in this. And based on these things, we distilled it down to that tool that I just showed you and developed education, so some scripting and just some basic messaging about what the purpose of this whole thing is. And we had a big launch date, and then also laminated these tools to post in each of the rooms so that they could be reused using dry erase markers. And this accessibility was really instrumental in having people take up use. So the general implementation in the WICU, the pilot, went very well. As you can see, this unit is very dedicated to patient and family-centered care from the beginning. So this is not very surprising. So we're sitting here thinking, okay, so that's one unit. So what? So we had the chance to expand what we did in the WICU through Project Emerge. And this is an ICU redesign project through several units at Johns Hopkins and in 2 different facilities at Johns Hopkins Health System. And as part of this ICU redesign, we made a patient-family portal, and it's basically sort of like an app or a web page that you could put on a tablet, and you would give the tablet to the family member when they come into the ICU, and this could help support their time in the ICU. They could understand the surroundings more and be more involved. And so integral to this is the family involvement menu. So you can see here, this is the prototype for the patient-family portal, and here we have the family involvement menu. So if the family member was interested, they could click on it to find out more. And here, the second screen would take you to a list of activities that they could choose from. And again, we emphasize that this is a personalized process, so the family member could choose what is important to them, what they would like to participate in. And then if they clicked on something, for example, mouth care, we would tell them more about what it is, and then down here they could say, oh, I would like to participate, and that will lead you to a scheduling screen where you could schedule time to talk with the nurse, to learn more about what to do, and also schedule time to actually do the activity to keep them organized. And as part of Project Emerge, we also wanted to build upon the initial more anecdotal pilot at the WICU and understand more qualitative and quantitatively what the perceptions of the patients, perceptions of the family members and the clinicians were. And so here you can see a very high percentage of family members are comfortable talking to their healthcare providers, and they're comfortable in participating in the care of their loved ones, but a slightly lesser percent feel included as part of the healthcare team and understand the condition of the patient. From the clinician perspective, we also see a very high percent, 92% consider patients and families as part of the healthcare team. But what does that actually mean? Only 78% are comfortable inviting them to participate participate in direct patient care, and also 16% consistently do so. So we see that there is some interest and some room for improvement as well. And we also surfaced some barriers for family engagement. So, for example, some family members indicated they were afraid of harming the patient. So, for example, things like early mobility, they may be afraid, oh, the patient would fall. Some family members indicated they were uncomfortable, for example, with activities such as bathing. They would be embarrassed if they see their loved one in that condition. And so you can see there is some variability in different family members' perceptions and interests. And some, for example, 14% indicated they're just not willing to do anything, and which is perfectly fine. And I think that highlights one of the strengths of the family involvement menu, is that it provides the choice to the family member to decide which ones they would be interested in learning more about. So to summarize sort of what we've learned to date from the surveys, from the pilot, the potentials of engaging family can increase nursing availability for other tasks. So while your family member is helping you with oral care 5 times a day, the nurse could help with other activities that require more clinical experience. Enhance relationship building between the clinician, team, and the family members. Introduce early education for family members to help better prepare them for transition and discharge. And also improve the patient care experience. So, for example, if the patient did not have, the nurse did not have time to conduct early mobility for a particular patient, the family member could be doing that. And that was what we saw in the WICU, a lot of patients walking around with their families. So the family involvement menu can be a strategy to include family members. And I would just like to end by saying that the family involvement menu is a work in progress, and I talk about it as if it's a tool. You know, I showed you the screenshots and things like that, but actually it's a process for how you develop such a tool to engage your family members. So understand your unit culture, collect some baseline data, look at what you've done on this journey already, and what opportunities there are to synergize with that, and then adapt based on what you learn. Thank you.